Welcome to another exciting episode of Homefront. It's Rome, and I have the honor, the privilege to be joined by one of my great brethren in the business. Somebody, when I started my entertainment career, was right there with me. Welcome, Des Vignes.
Thank you so much for having me on Homefront. Great to be here, Rome.
So Hans, we brought you here on the show because we want to discuss the effect of COVID-19 and the pandemic on the entertainment industry. Yeah, I open big there, boy.
No, it's an interesting conversation that we're ready to have, you know.
In terms of the effect of the pandemic on the entertainment industry. So for the people who don't know, because I know you for donkey years, give them an idea of Hans in terms of all the different hats that you wear in the entertainment industry.
Well, in terms of the entertainment industry, I have been a television producer and presenter for the past 15 odd years. I'm also a radio presenter and event host / MC, because I also do the party thing as well. So all in all, just a media personality out of Trinidad and Tobago representing.
So Hans, and then internationally as well too, because I saw you're doing stuff outside. I know that you travel, they do hosting out there with micing at parties too, and then you would do some of the TV stuff. I saw that you were covering Miami Carnival. And I met you out there as well. So in terms of you being a media personality and entertainer yourself, how you think the pandemic has affected the industry as a whole?
Well, I think firstly it affected the individuals mentally, and that's something that we don't talk about enough, like how the pandemic affected people mentally and their mental health and their ability to create, or the lack of ability to create given the current situation. Now, in between all of that, you had some people approaching it differently. So some people created more during the pandemic, some people were able to expand their brand during the pandemic, some people weren't able to do that. But it affected us, of course, financially. That was the main thing, you know, people in entertainment. A lot of people were saying, you know, these entertainers make a lot of money, why they getting on so, why they pretending that, you know, they really need it. But the truth is, they needed it. The truth is, people in entertainment needed money during this time. And there are some DJs in our country who actually had to go different routes in terms of employment. Things that they are not accustomed to, and they had to do.
In that you have entertainers who may have taken a different career path during the pandemic?
Yes.
We talking playing as in people who would have been a DJ or a singer, they're doing something else now?
Of course, and that's exactly what happened. They had to bite the bullet, swallow their pride, and do what they need to do to make money during the pandemic. Now, for a lot of people, it ended up being a good change or setting an additional stream of income. But when you really think about some of the things that were being said about people in entertainment, there were a lot of insensitive statements, because reality is they needed money during this time. Because I don't know anyone, I mean, there may be a few people, but for the most part, I don't know people who could survive 2 years without their salary. When you think about it. And
I hear people saying that them entertainers is big shot.
Exactly.
They saying about them.
But when we take it even a step further, look at where we are now in terms of doing the show. The cameraman, the audio people, the directors, the producer, they would have been in scenarios where they're not able to earn what they were able to earn over the past 2 years, because it may seem simple, but without a carnival, their salary is cut in half for the entire year.
Right.
And this is not someone who has a big mansion and $1 million sit down in the bank. This is someone who is a middle-class worker.
And this is their bread and butter.
This is their bread and butter. This is their industry. This is their space.
And I'm glad you brought up that, because I think a lot of people, because they see us as entertainers, they see the glitz and the glamour, we on a stage, or we dress nice, or some entertainers have a nice vehicle, or whatever the case may be, and you think that as the glitz and glamour side of it, but you don't see all the different assets, all the different elements of the industry, of the entertainment industry itself. In that, as you mentioned, the cameraman, all of the small parts that make the industry come together as one. So you might see the big artists, and they may be okay.
Artists, but you're not seeing the artist manager, the person who,
the
makeup
the
artist
stylist,
who's makeup. Exactly,
all of these people who make up the industry itself now. Now this is the industry as a whole, but let's get a bit personal. How has the pandemic affected you personally?
Okay, well, personally, of course, just like everyone else, it would have affected my finances. Like, no matter who you are, the pandemic would have affected your finances if you're in the entertainment industry. So that's the first point. The second point is during the pandemic, there were a few months that just felt cyclical. Like you just go in, you're doing the same thing over and over. Your Monday doesn't feel different than your Tuesday, Wednesday, Thursday, your Friday, Saturday, Sunday. You just feel like you're in a weird cycle.
I'm Dr. Osafu Fraser, County Medical Officer of Health for County St. George East. Yes, the COVID-19 vaccines work. Based on the research conducted in many countries globally, we know that approved vaccines significantly reduce your chances of both getting and spreading the virus. Even if you do get COVID-19, the vaccine is effective at preventing you from getting very sick, ending up in hospital, and dying. Simply put, the COVID-19 vaccine can save your life and the lives of your friends and family.
You just feel like you're in a weird cycle all the time because there's nothing that you can do. So you're just in the same cycle and it affects you mentally and you just feel like, sometimes you ask yourself, what's the point?
Well, I personally went through a rut, creatively, when the pandemic first hit, because people were asking, well, when you're bringing out parang music, when you're bringing out music, when you're doing this, and I was like, dread it, is there no Carnival coming? Christmas looking grim. This was when the first year of the pandemic last year. I was like, I just not in the mood to create music. I just wasn't feeling, normally I had to get in that parang mood or get in that soca mood, I just wasn't there. Did you have any moments like that being a creative yourself?
No, here's the thing. I went into that zone at points in time, but I went into what could I do? So I created a series on Instagram that I did a few episodes of called What's Good.
Right, I remember that.
Yeah, where I was highlighting good things happening around us. Yeah. So I had my little spurts of creativity, but overall it did affect my creativity and where I could go next. And you spend so much time wondering, what can I do and how can I move forward during that time? Because there was so much uncertainty, and that's something that people have not stopped to think about. The months of uncertainty of how long is this pandemic going to last? Like we are still in the pandemic, but at least there's a light at the end of the tunnel because we see what's happening in terms of vaccines and vaccination and countries moving forward and industries opening up. But the truth is, there was a point in time that we didn't know how long this was going to last. And there was also a point in time where we were in denial that this would even last past 3 months.
I thought so. I swear this thing would be a 6 months and we done and we over with it.
Yeah.
I didn't think we're going into year 2 and now we're going into our 3rd year of this. And you mentioned a point in terms of you've seen a light at the end of the tunnel. I know that borders have been open for a while.
Right.
I personally know you, and I know that I saw you out there in Miami. How was that experience for you in that borders are open? Do you think that a lot of the entertainment industry representatives took that opportunity to travel abroad?
Of course they did. Of course they did. When you see you're in a scenario where you've made $0 or close to zero, or let's just say 10% of your income for the past year and a half, and you have an opportunity to go out there to a fan base that is willing to gravitate to you, and you could have bookings over the weekend and you can actually perform, obviously you're going to take the opportunity. So we did see a lot of the entertainers taking up the opportunity, some of them still in the US or traveling worldwide, UK, or even through some of the other islands within our region that are opened up a little more. So yes, they took the opportunity. I mean, we all took the opportunity to do what was best for us mentally.
And I know that Hans is a person that is well connected. He knows a lot of the artists personally, a lot of the DJs. So when you met them out there, and you all would have obviously been having discussions backstage. Again, we're not calling names, but the feel you got from them, are most of the entertainers vaccinated?
In my opinion, and from the feedback I got, yes. When the borders were open, and I want to applaud you, Rome, as well, for being behind the vaccine drive for people in the arts. We saw a lot of people going to get vaccinated. I even met up with Duvon, who is a pan arranger / player who arranged the year Renegades won Panorama, and Duvon was actually in the US doing different lectures in different universities and doing different bookings, like playing outside of Foot Locker, because there was an interest in the steel pan.
Right.
So yes, they did get vaccinated. Yes, they took up the opportunity, and they're just doing what they need to do to survive.
So if you're seeing that the entertainment sector taking the vaccine, right now Trinidad and Tobago, not even 50% of our population is vaccinated.
But here's the interesting thing about what you're saying, Rome. There are some entertainers that chose not to get vaccinated, and they've decided to stay. Some have even gone as far to be very vocal about not getting vaccinated.
I know.
And whilst I would say that people do have a right to choose to get vaccinated or not vaccinated, and it's a choice, I do understand it. We need to understand, as a population, our choices do have consequences. And I was reading an article by Paho the other day with David Rudder speaking about the polio epidemic. And he was talking about polio and the fact that the vaccines were out for so long before they were able to come out of that pandemic. And there was it's the exact same situation happening now with the vaccine hesitancy. And he was saying, because he actually contracted it, there are ailments that he deals with to this day because of it. And I was watching a previous episode, and Dr. JP, she actually spoke to it, that there are long-term effects of COVID. And when you think about it, when we see or hear people who end up in the ICU in Trinidad and Tobago, now you hear them after saying, I wish I had taken that vaccine. And it's such a simple act, you know. We have a variety of vaccines. Choose whichever one you want.
Yeah. So we're going to take a short pause where we invite you to relax as we go to our mindfulness moment.
Hi, and welcome to our mindful moments. Today I want to introduce you to our mindfulness jar, or our glitter jar. When we feel really stressed or nervous or anxious, our feelings can really feel that they overwhelm us. And the glitter jar reminds us of that. So I've got one here with my blue glitter. I'm just going to demonstrate what it might feel like. So when we're really feeling stressed or frustrated, it can feel like our feelings are swirling around and it's not clear what we need to do or where we need to go. So we can use our glitter jar both with our eyes and with our breathing. And what I encourage us to do is just to breathe in and out slowly as you focus on the glitter settling. Just picturing it as it falls slowly to the bottom of the jar. As it does that, you'll notice that things are becoming clearer and that those big swirly emotions that we were experiencing are starting to settle down. Using your breath and the point of focus like the glitter jar can really help remind our nervous systems that we're not in danger and help us see clearly the way we need to go forward. This is an easy one to make at home. If you have a snow globe, that works as well. And you can use a tool like this in your toolkit for mindfulness to remind you that using your breath and your breathing can help remind us the power of being here now.
It's Rome, and we are here. We're chilling with the boys. We're living with the kids. We're doing this all for the PedCares Foundation. So we need you at home watching us to go donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yeah. 1, 2, 3. Yay! The PedCares Foundation. All right, so that was our mindfulness moment. We are back here. We're talking entertainment and effects of COVID-19 and the pandemic on the entertainment industry. We are here with Des Vignes, our entertainment Guru?
Personality, I guess, personality, you know.
He given us a bit of insight in terms of the industry. Hans, we were just speaking right before the mindfulness moment about the entertainers, some of them taking the vaccine, and we were talking about, you spoke about David Rudder.
Yeah.
And now we're in a situation where Trinidad and Tobago is less than 50% vaccinated. In your opinion, from what you've been hearing on the ground, because you're a man on the ground too, Hans is a man on the ground, he speaks with a lot of callers on the radio, so he hears the ground and he on the ground. What you've been hearing, why do you think people are not taking this vaccine? Like, why do we have such vaccine hesitancy?
We have such vaccine hesitancy because we are a population that questions, and questioning is fine. However, sometimes doing that too much could put us in situations and problems because we spend so much time asking that we don't spend enough time doing what is necessary for us to move on and move forward. So the first thing that we need to look at and understand is that out here, everybody knows somebody who do something. Now, are those substantial stories that can be backed with facts and people willing to come forward? Not all the time. So we're in a scenario of a lot of misinformation. Everybody's saying what they feel and who they know this happened to, and we're going into these stories over and on. These stories just snowballing over and over and over. Now, there's another problem with this whole misinformation situation. People that have the information, we've reached to the point where they rather not have the conversation. I think that's a dangerous place for us to be.
Yeah, I hear it all the time too. People say, I don't want to hear about no vaccine.
And that's interesting.
I don't want to hear about no COVID
Because,
talk.
Rome, you and I are both on radio, and both of us, in the past, have avoided the vaccination conversation because
Topic.
we've had the correct conversation. We've done the responsible thing. Bring a doctor on our radio show, have the conversation, give all the information. But even after the doctors give the information, these professionals who have been studying for 10, 15, 20, 25, 30 years of their lives, dedicated to research and information, we brought them on the shows, and they gave the information.
People still didn't listen. So,
and that's what I'm
right,
saying.
and
People didn't listen, and adding to them not listening, they going into saying, but that doctor talking stupidness,
right?
Which is a scary thing as well.
So in terms of entertainment, you think if the entertainers were to come out, because you know that you have some vocal entertainers who would say not to take it.
Right.
Do you think if there were more entertainers who would come out and tell people they took the vaccine and encourage people to take it, would you think that that would make a difference?
I'll be very honest with you. At this point, I don't. Tell you why I say what I say. It would just go into people saying that they pay these people to say these things.
Right. I get that myself, eh?
Exactly. You
All the
get
time.
it, I get it, we all get it. I mean, we're sitting down here in this show, people go and say, boy. But I think what we need to do is we need to have the conversations in terms of we need to sit and listen to those who are anti this vaccination, because it's not necessarily that somebody's anti-vax. A lot of times they're anti this particular vaccination process because they have questions. But those questions can be answered if we sit down, listen, and discuss. And I think there's been a lot of talking at, but there's not been enough speaking with.
I agree.
And that's something that we need a lot more of.
But you went out there, you saw Miami Carnival, you saw how it unfolded. Do you think that if we come now and we say we're going to have a carnival for a vaccinated population, would that encourage the vaccine hesitant who may enjoy carnival to go get vaccinated?
I think it will definitely encourage them. The way we would have a carnival in 2022, if the decision were to be made, it will be a lot different. We both know this. It will be a lot different. It will be most likely in a controlled space or controlled setting. It will be different for the vaccinated. It will be very different than what we are accustomed to. However, I do think it's a possibility. We saw what happened in Miami. We are here in St. Kitts and Nevis and St. Lucia and other countries. They're moving forward with their carnivals. So I do think it's a possibility. I do think it can happen. And I look forward to a potential rollout, whatever that may look like.
Right.
Because I think being in Miami and even speaking to some of our counterparts, Trinidad and Tobago, we don't realize it a lot of times, but we live for Carnival. Meaning it impacts all of us in some way, form, or fashion, and it's part of our cycle of life, you know? So I
don't think people understand the ecosystem that Carnival itself is that a lot of you would think of Carnival and the first thing you're thinking is bikini beads, feathers, wine and jam on the road. But you don't think of the trickle-down effect of from the masquerader, you have the bands themselves, and then all the people that the bands would hire. You have the security personnel.
Yes.
You have the people who will come on the side of the road to sell to the masqueraders, all the vendors, the corn soup man, the chewing gum man, even outside the fete, you have the scalper, and then to prepare you to go to a fete, you
well,
have
I wouldn't
the
promote the scalper in this situation.
But the scalper making our money too. The scalper eating our food.
That's how is it.
But you have all of these different people who would hands had to go and get a shave and a mark and a barber, the hairdresser, the clothes stores who had to sell the clothes to the people who go into
the makeup artists that waking up 4 o'clock in the morning to do faces.
The taxi driver who had to drop you because you don't want to come back home drunk and driving. Is so many different people are involved in the entertainment sector that I feel that a lot of the public only pay attention to the person on the stage.
Yeah.
But you don't see what is happening behind. And this comes into my final question with you, is that do you think that the entertainment industry itself was given enough focus during this entire process, this pandemic on you?
Well, truth be told, our industry is a social industry. And when there's need for social distancing, obviously you all are the ones that are going to be affected. Was there enough consideration given? That's a tricky question. I mean, each person will have to speak on their own behalf of what they think should have been done. And whilst everybody would say what they think should have been done, was it really possible to do? So we were considered, yes, to a point. Could more have been done? More could always be done. Was it possible? Maybe, maybe not. Would it have been the best decision? Maybe, maybe not. But we are at a point now, Rome, where there is a solution. There is a possibility out of the pandemic. It's not that the doctors are guessing. What eliminates current science and proves current science wrong is better science. By better research, better investigation, and findings. We are in a scenario where we have the opportunity to reach the end of this tunnel. We have the opportunity. It has worked many times before, for many different pandemics. This is not the first time the world has experienced a pandemic. This is not the first time a vaccine has been created. It's not the first time a vaccine has been the solution to the pandemic.
Right.
We have a solution. We just have to choose that solution.
So you're hearing it from somebody in the entertainment sector. Hans has been here for many, many years, and you have been vaccinated, Hans?
Of course.
And if you had to talk to Trinidad and Tobago right now, what would you tell them?
Listen,
on behalf of the entertainment sector?
On behalf of the entertainment sector, well, me personally, because I can't speak on behalf of everybody, but for those that have taken their vaccine and have made that choice, we urge you all to go out and get vaccinated. And I really hope that more and more we could have these discussions and possibly hear from people who don't want to get vaccinated, understand why, have a doctor on the other side of the table, and we talk. We have that conversation back and forth of why not, and not shouting at, not telling, but listening and understanding and transfer of information. Because I'll be very honest with you, Rome. At the start of the vaccination process, it globally, not when it reached the Trinidad and Tobago and it rolled out in this big way, I would have been one of the people that was hesitant. And then you have discussions with those with the knowledge. And you notice what you were hesitant about is something that has happened before. There are professionals in every field. They're professionals in terms of engineering. We rely on them when we're building our houses. They're professionals in terms of aeroplanes, we trust the pilot. We trust the engineers behind the planes. We trust them because they've worked, they've studied. We need to trust our doctors. They've worked, they've studied, they have the information, and they're advising us the best way they know how. So we trust professionals.
All right. On that note, we want to thank you all for joining us for another episode of Homefront Hands. Thank you,
man.
brethren.
Yes, bro.
Good to see you on our set, man.
Always. It's been what, like 10 years, 20 years?
Yeah. On behalf of the entertainment sector, we would say, guys, in order for us, we are in a sector where social distancing is difficult because we know what Carnival looks like on the road, and that's going to be difficult. So we way that we see out of this thing for us to get back on the road for Carnival Monday and Tuesday, to fets, to pan, to calypso, to stick fighting, to all of the different elements of Carnival that make up our unique Trinidad and Tobago's Carnival. We need you at home to go out and get your shot. Think of our sector and all the ripple effects that would have, for, as we said, from the taxi driver all the way up to the masquerader is a big industry, not only the person on the stage. So with that, my name is Des Vignes. Thank you very much for joining us. This is another episode of Homefront Dwellings. Thank you. The place looking nice. Now, I want thing like this home in my house.